everyone to today's Business Solves panel exploring multi-sector partnerships that help protect the globe and strengthen global health. My name is Jennifer Latito. I am the president and COO of RED, nonprofit founded by Bono and Bobby Shriver that partners with the world's biggest brands to create RED products and experiences, all of which raise money for the Global Fund, one of the world's largest funders of global health. We have a fantastic panel assembled here, and it's my absolute pleasure to introduce today's participants. Dr. Julie Gerberding, Chief Patient Officer and Executive Vice President, Population Health and Sustainability at Merck. Jeremy Konyndyk, Executive Director, USAID COVID-19 Task Force. And Wes Wheeler, President of UPS Healthcare. Thank you all so much for joining us. I know our time is tight, so Jeremy, I'm going to just dive right in and start with you. USAID has had a long history of leadership combating infectious diseases like COVID-19, Ebola, and others around the globe. Tell us about the pivotal role you are playing in fulfilling vaccination goals and the partnerships that are helping to meet these goals. Over to you, Jeremy.
Thanks so much, Jennifer, and it's a real pleasure to be speaking to this group today. The partnerships that we have with the private sector and with the nonprofit sector, as well as with organizations like the Global Fund, are so central to everything that we do and anything that we achieve on the global scene as the U.S. government. And obviously for USAID, those are really critical relationships as well. So the president has laid out a really ambitious vision for vaccinating the world. He has talked about the U.S. being the arsenal of vaccines for the global vaccination effort, and that's what we are delivering on now. So the administration has committed to provide at least 1.2 billion doses of COVID-19 vaccines around the world. Obviously, that's more than we will consume domestically. So we're stepping up in an enormous way, and we're doing that with the partnership and the involvement of a lot of different organizations. So obviously a lot of those doses build on the public-private partnerships that the U.S. government entered into over the past few years in generating the vaccines and producing the vaccines in the first place. At ground level, they're also we're working with private sector partners to help deliver those vaccines, to promote vaccine uptake and confidence, and that builds on, I think, a long history, as you've said, of USAID partnering with private sector companies in our global health efforts on things like everything from messaging, public messaging, to supply chain. There's really no way that we can execute on the scale and the ambition of what we need to achieve collectively as a world over the next year to begin getting back to normal without a really tight partnership and engagement between the public sector and the private sector. And so we're working hard on all fronts to do that with public sector, with partners like UNICEF, Global Fund, Gavi, but also trying to be as hand in glove as possible with private sector partners. And we've been working a lot with the Chamber and BCG and other private sector partners in the last few months to really scale up our level of engagement there.
Thank you so much, Jeremy. It is such a massive undertaking, as you mentioned. Julie, I'm going to go to you next. Merck has been on the front lines of the biggest public health emergencies in recent history. And just, for full disclosure, as the head of RED, I just want to say Merck has been an incredible RED supporter and has played an invaluable role in helping us in our efforts to bring critical awareness to the global AIDS crisis and the need to fund efforts that will help end the HIV pandemic, which is obviously something RED has been doing for the past 15 years. But in the case of COVID-19, you have collaborated to make vaccines for a competitor in Johnson & Johnson, and you've partnered with a small company in Ridgeback to develop oral antiviral medication for the disease. I'm just curious if you can tell us how Merck is using partnerships to help contain the pandemic in these extraordinary times.
Well, thank you. And I just want to say that red is my favorite color. So we appreciate all you're doing for that effort as well. I think partnership is the theme word of this entire pandemic. When you think about, for any of the important countermeasures that have come forward, it has really taken the entire ecosystem of partnerships from academia, where a number of the early discoveries were made, to small biotech companies that have really, gone at risk to really push the envelope on innovation, to the government funding and the government research that's gone on in several countries, and especially in the United States, but then also bringing in the larger pharmaceutical companies who not only are innovators, but can really help accelerate the scaling. I think it would be impossible to imagine that we would have the supply of vaccines that we have today if it really weren't for the larger pharmaceutical companies who not only have the know-how and the experience, but have the scale and, in a sense, the ability to take the financial risk that kind of adding this additional capacity really puts in play. None of this is fully de-risked, even though I think our government has done so much to try to help make sure that the capital is there to do the manufacturing expansion and the overall access planning. So I think that segment of partnerships in creating and developing and then manufacturing the important countermeasures that we've already been able to take advantage of has been really critical. But of course, there's a whole other kind of partnership that's also been relevant to all of us. And that includes the large scale partnerships like Warp Speed or COVAX, and then hopefully, ultimately, soon to be developed, or at least hoped to be developed, partnerships that will really complete that last mile where we actually get vaccine in the arms of the people who need it the most, especially in the least resource areas of the world. So I think, when this is all said and done, we really need to examine these partnerships and understand how can we really, truly learn from these experiences and embed them in a different way of operating broadly to solve some of the other global health problems that we have.
Yeah, it's fascinating how this pandemic has brought out the best of companies. So, companies who are competitors are working together as collaborators. It's really fascinating. And to your point, let's hope that we can look back and maybe bring some of it forward in the future. So Wes, I'm going to come over to you. UPS Healthcare has played a critical role facilitating COVID-19 vaccine delivery around the world, which is a huge and historic task, and one that we could probably spend hours talking about. But how are you working with partners, to ensure equity in your efforts? Oh, Wes, I think you're muted. It's always got to be someone.
Can you hear me?
Yes.
Okay, well, I was unmuted. Anyway, thanks very much, Jennifer. I appreciate it. Listening to the last segment, it took me back actually before vaccines. So we were very, very much involved in Project Airbridge. So our first partner was actually FEMA and the US government, getting PPE and even ventilators and all kinds of equipment, mainly out of China. We moved about 26 million pounds of PPE into our facilities in the US into the national stockpile. We had 250 charter aircraft, 747s with our pilots coming in every single day, sometimes twice a day, just delivering that kind of material in. So our first partner really was the federal government. We got involved in clinical trials pretty much after that, about April of that year. We had a good insight based on the protocols that were being published publicly. We got to see how many patients would be recruited. It gave me a really good clue that we would be rapidly developing this vaccine, more so than I've ever seen in my career. So we got involved right away with developing supply routes, things that we thought would happen, manufacturing sources around the world. We got involved very, very early with Operation Warp Speed. We became pretty much an equal partner with the federal government, with General Perna and his team. The thing that really worked in the US from an equity standpoint is that early on, an algorithm was created by the government, I think managed by the CDC, to give every state an allocation based on an equal algorithm based on population. And based on that, the allocations were created every single day when we launched in December 15th of that year. And against that allocation, every state was allowed to order against that allocation. And that ordering process was managed by Operation Warp Speed. And the UPS and FedEx split the country, and we did that equitably. We had 50% on either side of the country. We worked alongside with McKesson on the kits. We built the dry ice factory, and we worked for a while, every day, and then even to this day, every week, with the government, with McKesson, with Pfizer, with Moderna, and with, of course, our FedEx competitor at this time was a team. And that sense of teamwork made it all work. And to this day, with all the mapping of all the lanes and all this capacity we carved out, even during peak season, during the worst nor'easter we've seen in years, we were able to deliver to the US population, and now nearly 70% of the population over 18 is vaccinated. We're very, very proud of that. Now pivot from there to the rest of the world. And since then, we've actually delivered twice as much to the rest of the world that we have to the US. We've now delivered, as of yesterday, 906 million doses to 107 countries at 99.9% on time by day. We're extremely proud of that. And the reason why it happened that way is because we did the planning up front with full transparency from the federal government. And of course, with Pfizer being the lead in the development of their vaccine, they actually went out, as countries were approved around the world, they were selecting by country the proper distribution partner. So we got about half the world from Pfizer, and our competitors got the other half. And so as the approvals came in, the allocations were made, the orders were placed, and we worked hand in glove with Pfizer as the primary decision maker in how distribution happened. And because of that, we've been able to maintain that on-time performance. Now, the reason why I bring all that up is because pivot now to COVAX and the African Union and the distribution of other countries of the Moderna and the Janssen vaccines, et cetera, we need to make sure we follow the same kind of process. That's the process that worked. Allocate by the WHO or COVAX or both, allow UNICEF to make proper team decisions based on who's the best distributor in that country, and then let us take care of the details. That means first mile, last mile, middle airlift, and then make sure that we're getting the last mile completely covered, the last inch, right down to delivering freezers in Africa to make sure they can keep these medicines on stability right up until the very end. And in many cases, we've got to get delivery within 48 hours in order to maintain stability. So the lessons from the US need to be applied to the rest of the world, in my opinion.
Well, sitting here in New York City, I'm very grateful for the efforts that you made to ensure all of us are stayed safe in the beginning and continue to stay safe. And to your point, let's see how we can continue that for the rest of the world, which is so important. So the pandemic has understandably dominated the headlines for so long that I feel like we've sort of lost track of how many critical and present healthcare issues there are beyond the COVID-19 crisis. How has COVID-19 impacted people returning to care for routine vaccinations, important screenings, and ongoing therapies? Julie, I'm going to start with you.
Boy, this is really an important question. I think just a couple of weeks ago, the WHO reported that more than 20 million children did not receive their needed measles dose last year. And that means inevitably there will be measles outbreaks because that is such a highly infectious disease, and for way too many children, a highly fatal disease on a global basis. So that's just kind of the one snapshot of the nature of the problem. But it isn't a problem that's just limited to developing areas of the world. It's a problem in our own communities in the most developed countries. And the reason for that, well, it's complicated actually, because in one part, our health systems at times were undersurged and really unable to provide routine care services. People were sequestered in their homes, unable to go out to receive the care. And while you can get a lot done with telehealth if you have broadband and are a sophisticated user of digital technologies, but you can't get your mammogram on your cell phone, you can't get your colonoscopy or a number of the other really important cancer screening efforts. So we've fallen way behind. And that means that cancers are being diagnosed later than they would have been. And that means that treatments are necessarily more complex, and we'll see less success in delaying or curing many of these cancers. But we're also even seeing chronic diseases that are managed with tablets or routine primary care monitoring also move people into higher risk categories, increased demand for renal dialysis among patients with diabetes, and excess cardiovascular and stroke risk in the United States, independent of the additional morbidity brought on by COVID per se. So I could go on, but I think we get the picture that the toll of the pandemic isn't just due to the virus and its direct effects on health. It's the ripple effect from the lack of the ability to contain and sustain the usual elements of care. And of course, I should add into that list of reasons the fact that people who are really suffering financial hardships or have lost their insurance or their jobs during this really are in a place where they absolutely cannot access care, even if they're well-intentioned and know they need it. So I think one of the lessons for me personally, since I spent a great deal of my time in government service, thinking about how to prepare our nation for a pandemic from a medical health perspective, that when we're thinking about that, we have to think much more broadly than just the threat that has emerged. And we have to think of it in the context of broader healthcare needs, social determinants of health, but even more broadly than that, to assure that we provide the financial support necessary to keep people going while they deal with the non-pharmacologic interventions and all of the other disruptions of their life that this pandemic has imposed. Lots of learning here. And of course, as much as I'd like to be optimistic about the way ahead, we are definitely not through this pandemic. We're coming into a season where people get distracted by holidays. We may see a surge in COVID because of the holiday season, and that often tends to make people delay their routine primary care even more. So as families are coming together, I would really urge people to think about how can we be good family supporters of returning to care, and how can we all be good ambassadors of reminding our networks, whether it's our employees, our colleagues, our friends and our families, that it's a really good idea to get back into the routine of receiving your normal healthcare services, including your cancer screenings and your other vaccinations, including a flu shot, I might add.
Yeah, thanks, Julia. Those are all really good points. I mean, it's interesting, and this is happening everywhere. I was actually, coincidentally, I was doing a panel this morning with our beneficiaries in Zambia, and they were having, there are slide backs that could happen with HIV, something that we've obviously been very focused on because people are afraid to go into the healthcare clinics. So I think that is, all of the points that you made are so true and really need to be a focus. Jeremy, I'm going to come to you next. So what is happening in global health beyond COVID-19 crisis that we should be paying attention to from your side?
Well, picking up on some of what Julie said, I think what we have seen in this crisis is how much when we have to do an emergency response of this type and on this scale, we have to do that with the assets that exist. We don't have some big reserve army of healthcare workers and healthcare assets that's sitting on a shelf somewhere that can just roll out. We work through the systems that exist. And so the core baseline investments that the world makes in global health services are what we also put into frontline use during a pandemic. And so, for example, much of the diagnostic capacity that's been built up through HIV/AIDS interventions over the past few decades was then repurposed and refocused to do COVID diagnostics in PEPFAR countries. We've seen that obviously the workforce that is treating the COVID patients is the same workforce that needs to treat HIV patients and TB patients and do routine immunization. And so there has been a lot of disruption. I think it's been mitigated well in some instances. HIV hasn't taken as big of a hit in terms of enrollment in services that as we feared it might. ARV coverage has still been pretty robust. TB has taken more of a hit. And we've seen a real hit to some of the routine immunization programs. I think we're going to continue to see that. And one of the things to watch over the year ahead, as the global vaccination effort scales up, will be the bandwidth trade-offs for developing countries between doing COVID vaccination and doing their routine immunization. I think another thing we're seeing is a huge strain on healthcare workers, and obviously we're seeing this in our own country. There was a Washington Post story just yesterday about huge strain on health workers and a lot of people thinking about leaving the profession because the last 2 years have been so rough. Similar challenges in many countries, and of course in a lot of developing countries, they still have large unvaccinated portions of not just their population but their health workforce. So you can't draw a clean line, I think, between COVID and the wider global health impacts, because it's all at the end of the day kind of one workforce, one system, one set of resources, and we really need to think carefully about how we protect and preserve that system.
Absolutely. And Wes, over to you from a UPS perspective. Anything from a global health perspective you guys are focused on? Anything else?
I'll answer with two items. First of all, we're very involved with clinical trials. We have a subsidiary that focuses on clinical trial logistics, including home healthcare support during the trial. We're already seeing a major pivot to this sort of light speed approach to getting vaccines and specialty biologics approved by the authorities, FDA and others. I think we have to prepare ourselves for more of this rapid development. They're finding ways to really get through the development cycle much faster. Instead of years, it's taking months. I think we as a supplier have to make sure we have our cold chain facilities set up, we have proper air routes identified so that we can respond quickly, not only to a pandemic, but also the explosion of biologics and cancer treatments being developed and vaccines being developed with this new mRNA technology. So that's the one thing we're preparing for now, looking at the major air routes, including air routes from Asia, India, South Korea, to make sure we can get these materials to the countries that need them quickly. And the second point, to build off what Julie said, is about home healthcare. During the clinical trials for the vaccines, we all know that clinics didn't want the patients coming in and patients didn't want to go to the clinic. And so we had to pivot to a home health clinical trial, virtual trial technique with nurses going to homes and administering drug and then collecting the blood, bringing it back to the lab. We've now perfected that process, and we need to really expand on that, because in the future, home healthcare, routine physical exams by doctors will be held at the home, and being ready for that whole shift in how healthcare is delivered is going to be changing the way we work in the future.
Thank you so much, Wes. So, even before this pandemic, we've heard about the importance of epidemic preparedness. It sounds kind of wonky, but, and the role that the private sector can play in enhancing global health security. I'd love to ask you, all of you, and Jeremy, I'm going to start with you. What role can public-private partnerships play in furthering global health security to make sure that we're better prepared in the future? I mean, if we can hopefully learn something from this. I worry that we're making some mistakes or repeating some mistakes, but I'm hoping that there's other things that we can learn because I'm sure there will be the next pandemic. And I'm just wondering, Jeremy, if you could comment on that.
Yeah, no, I think what we've seen over the last 2 years, right, is this is not a theoretical risk. It's not a wonky risk. It's not something that, I used to work in a think tank in between my stints in government, and I wrote a lot about this and was in a lot of meetings with Julie over those years, including one just as this thing was kicking off. It's not hypothetical. These things will hit. They will hit again. And you think of the literally trillions upon trillions of dollars that governments have spent, the trillions of dollars of impact on businesses' bottom lines, the huge disruption. We have a shared interest. I think everyone's interest points in the same direction here in being better prepared, and that's a matter of stronger public health systems. That's a matter of stronger early warning, which is an area I think we could do far better in. If businesses had even a month or two's warning of what was coming on COVID-19, they could have adapted a lot more than they did. And so I think that, we have a shared interest in getting this right. And I think that's going to take investments not just by government, but also by the private sector in the sort of systems that need to be built. It's going to take, I think for lack of a better term, a sort of a political constituency for this. Businesses signaling to governments that they want to see more investment in this area, and that they have a strong and material interest in not being caught off guard. And being better protected against this sort of risk. Of all the major disruptive risks that the world faces, we're probably still, even now, among the least protected against this one in terms of the systems and the infrastructure that need to be developed.
Thank you, Jeremy. Julie, I'll go to you next.
I just hope that when we look at this pandemic and really get serious about where do we go from here, that we have a mental model that says, health security is national security and global security. and that we realize that we have to invest commensurate with the degree of threat that we're facing. I completely agree with Jeremy. This isn't a once in a lifetime or a once in a century outcome. This is a part of our future, and we need to be much better prepared for this. And I think from the standpoint of the private sector, whether we're talking about the leaders of our business organizations as employers who influence employees and how people think about preparedness, how businesses themselves become part of the solution as well as part of the response capability, but also, again, as Jeremy said, as advocates. Because the one thing that we have seen that I think is very hopeful in this space is that trust in businesses is high. And right now, trust everywhere else seems to be at a premium. And so if we can get some of our trusted thought leaders and some of our community business leaders and even our small and large employers in the non-pharmaceutical spaces, of course, the non-health spaces, I think if we kind of align on unity of purpose here, it's a powerful force. And we really can provide a enlightened self-interest perhaps, but we can mount a powerful argument to the decision makers that these investments are important long-term investments for the sake of our businesses, but more importantly for the sake of our communities and the people we care about. So I don't think we're going to get to change easily, because as we've seen time and time again following previous health crises, there is a crisis, but then it follows very quickly with complacency. Right now, we have to maintain some level of strong motivation to not let that happen this time and to sustain our awareness, but also to secure the kind of investment over the long run to progressively create the solutions we need. I was in a Zoom conference last week with my colleague, Dr. Rajiv Venkaya, who's the head of vaccines at Takeda, and he made a statement that's haunted me ever since. He said, from a scientific perspective, we have the technical capability to take pandemic threats off the table. Not today, but we're very likely to be able to do that with the state of our science. But we do not have the social will and the political will to make the kinds of investments and the changes in our level of preparedness that would be necessary to take advantage of what our science and technology can bring us. So those are really important choices that we have to make. And I think the private sector is well positioned to be a strong advocate for that evolution.
Thank you, Julie. I wonder which one of those are going to be harder to push on. Wes, I'm going to give you the last word on this one.
Well, it's not over yet. I mean, I point to Africa because we're very involved now in getting vaccines into Africa, and it's I think less than 5% of the population of Africa, with the exception of Ghana, is fully vaccinated. We have a long way to go there, and I think what we have to do is learn the lessons that we just learned here in the U.S. and make better decisions about distribution. This is not a supply constraint issue. As far as I know, we've bought 1.2 billion doses for allocation. The US government, I think, should be more involved in making decisions here. Use the public-private partnership that we've developed already to let the people that are experts in logistics get a handle on how to do this and help us. I met with the African ambassadors a few months ago in Washington, and they're frustrated. I think we have an opportunity here to really take a leadership role in the world by getting more of these vaccines delivered faster into Africa in stability, and that means getting them freezers and local cold chain facilities. So we need to learn from that, and I think build on that so we can be better partners in the world to get the rest of this world back on its feet.
Yeah, and I think it's that they're all waiting for the vaccines from all of the conversations we at RED have had. So I think that, I'm so grateful to all of you for all of the work that you've done across all of the different private and public sectors. This has been a really fascinating conversation. Unfortunately, we are short on time. So I am going to wrap up. I want to give a big thanks to the U.S. Chamber of Commerce Foundation for making today's conversation possible, and to all three of our panelists, Dr. Julie, Jeremy, and Wes. Thank you all so much for participating in today's discussion, but more importantly, thank you all for the incredible work that you and all of your companies and organizations are doing. Appreciate you joining us today and hope everybody has a great day.
Thank you.
Thank you very much.
Thank you so much.